Welcome back. If you need cataract surgery or a number of other eye procedures, you may be in line for some cutting-edge technology. Here is Dr. Bill Trattler to tell you more. Dr. Trattler, it's good to have you back on the show. It's been a few months, huh?
Yes, thank you for having me.
Yeah, it's my pleasure. Welcome back. We got a lot of great stuff to talk about. What's really neat is there are some really innovative procedures being done at your office, right? So let's get into them, and let's start with the first one, the femtosecond laser-assisted cataract surgery. It sounds cool.
Yes, and it definitely is cool. It's a really exciting technology. Basically, the technology works like this. When we're doing cataract surgery, the traditional way was to use blades and basically extract the cataract and put a new implant inside the eye. It's extremely safe, very effective, but they came up with a new technology called the femtosecond laser, which automates the procedure, making it even safer. And so our goal is to give the best outcomes for patients, and this further improves our chances for getting patients the best vision with cataract surgery.
So let's just sort of rewind a little bit. How does somebody know when it's time for cataract surgery or when they need to see you potentially about having it?
Absolutely. So typically patients with cataracts will notice that they're having difficulty driving, especially at nighttime. They may see glare around lights. They may have difficulty reading road signs. And so they'll have difficulty with their vision. They'll come in for an eye exam and realize that glasses can't fix the problem. It's actually a cataract reducing their vision.
So, and this laser you can't find it just anywhere, right? In South Florida, there's only a few places that have it.
Right. Right now, there's only a few places, although I expect with time, almost every place will have it. It's just so innovative and works so well. But right now, only a few places have it in South Florida.
And is it a quick treatment? Do you only need it one time? What's the recovery? What's all that stuff?
Right. So cataract surgery is a one-time treatment, and the laser procedure itself is about 2.5 to 3 minutes. And basically, a patient goes under the laser. The laser takes a 3D image of the cataract and of the eye. You press the button, the laser works, and all the incisions are made, and then we get to finish off the treatment, removing the cataract and putting the implant in. But it makes it very safe and very effective at really restoring excellent vision to patients.
It's so crazy to me. I would imagine more so for you, like when you were in medical school, learning what you're learning. Did you think that when, by the time I had my own practice or whatever, there'd be all these laser surgeries and LASIK? I mean, it's nuts how you can get your eyes fixed in 20 seconds.
It's amazing. I know my father's an ophthalmologist. When he started doing cataract surgery 30 years ago, patients had to be put in sandbags. They had to put sandbags around their head so patients wouldn't move their head after cataract surgery.
Wow.
And they'd be in the hospital for 3 or 4 days. Now patients have surgery and they can drive their car the next day. It's basically like LASIK as well. We get to restore patients' vision. And we even have some implants that give patients distance, computer, and near, so they don't need glasses anymore.
It's incredible. Yeah.
Yes.
You're pretty close to the bionic eye, I guess, right? That's just a couple years away.
It's getting closer. We still have a little ways to go, but it's definitely, we're on that track.
Yeah, it's amazing. All right, let's talk about pink eye, because we have a lot of parents who watch the show, and I feel like kids get that a lot. Just from doing the research for this interview, pink eye is not always contagious. Is that true? I thought it was always contagious.
Right. Well, there's different types of pink eye. You could have pink eye due to a bacteria or due to allergy. So if your eye is red and it's itchy, it could be due to allergy, not actually to a virus. But we usually think of pink eye as the viral pink eye, and that is very contagious.
Okay. And in your practice, you have a methodology of testing whether it's contagious. Is that right?
Absolutely. So we try to figure out a way to how can we make certain a patient actually has pink eye that's contagious or not, so we can kind of educate patients to be careful, maybe avoid work for a couple of days and things like that. So they developed a new technology which looks like a pregnancy test. Basically, we touch this little device to the inside of the eyelid, and in 4 minutes or 5 minutes, it gives us a reading that tells us if a patient has a contagious pink eye or not, if it's caused by a virus or not. So we can rapidly diagnose it and then tell patients, okay, stay away from work. If you're with your family, wash your hands all the time and don't share towels because you don't want to pass on to other family members.
It looks so gnarly.
It is. Pink eye can be really challenging. It's very red and itchy, but thankfully if we know what the cause is, we can actually provide certain treatments as well to help.
Where are some of the places where you're most prone to get it? I would guess a school, but what are some other ones?
Right, so any place where you're going to be around other people who might have pink eye. So schools are common. Anytime there are places where you can see somebody who may have it and either touch an object, like for example, picking up this cup. If someone had touched it who had pink eye, then you touch your eye, you can catch the virus.
The last 3 people who touched that did have pink eye, so you might want to get to a washing station immediately. I'm just kidding.
Yes.
Okay, so I know that you're the director of Cornea, so you must be particularly proud of this. But you guys now can strengthen the cornea with UV light. What's that all about? Right.
So there's a very uncommon but becoming even more common condition called keratoconus. And keratoconus is where the cornea is weak and actually starts to bulge outwards. And patients may not realize they have it, but they'll start to need updates in the glasses more commonly. So they might have a pair of glasses, and then 6 months later, wow, the glasses aren't working well and they need a new pair. And they're getting more nearsighted, more astigmatism, and it's because the cornea is bulging outwards. And if we diagnose the condition, we could treat them with a short treatment that makes the cornea stronger and makes the cornea fall back into position.
So how does a cornea bulge outwards? Is that painful?
It's not painful. There's no pain whatsoever. It's just their vision becomes blurry and more distorted, and the only way they can see is with changing the glasses and eventually contacts. And so people who have advanced condition may require contacts to really see. They can't even see with glasses. So you want to catch it early.
This one is super interesting. When you go on a vacation, you suggest taking out the contact lenses and giving your eyes a break. Explain that one.
Well, here's one of the challenges. Contact lenses are wonderful. Patients can see beautifully with contacts. They're so convenient. But there is a risk of infection. And if you don't really sanitize your contacts properly, if you don't put them in the right container with solution and treat them properly, your risk for infection goes up. As well as if you sleep in contact lenses. So if you think you're going to travel and maybe just sleep with them for a couple of days, your risk for infection, again, will increase. So you got to be careful when you're traveling. You have to make sure you bring all your solutions with you. If not, it's better not to wear contacts because you might end up with an infection.
Do you suggest once every 2 weeks or whatever, just not wearing lenses? Is it important to give your eyes a break if you're not going on vacation, if you're just here?
Well, sometimes a little holiday from contacts can be helpful. We know that contact lenses can increase the risk of developing dry eyes, and that little break can help the cornea kind of restore itself and become a little healthier. So if you can take a break, wear glasses for a day, it can sometimes be healthier for the eye.
Yeah, just don't walk around without lenses or glasses.
Or drive without them.
Right, that's a bad idea. Exactly. Last thing I wanted to ask you was, are there any eye problems inherent to South Floridians? I know obviously the sun is strong here, but whether it's the climate or the landscape or anything like that, anything in particular that we need to worry about that some other people around the country wouldn't?
Right, well, UV light does have dangers, and so we do recommend wearing sunglasses because you can actually get cancer of the eyelid and also of the eye itself, and that's all related to UV exposure. Just like you can get skin cancer from too much UV light, you can get skin cancer around the eyelid, and then the eye itself has a covering that can get cancer. So we recommend wearing UV light, wearing hats, and be careful of UV because it can lead to cancer and problems.
Okay, I'm glad I asked.
Great question.
Wealth of knowledge. Last thing is, how can people get more information about you? How can they come see you? How do they find you?
Well, I'm in practice in Miami, Florida at the Center for Excellence in Eye Care. We have a great practice of 15 doctors, and we're always happy to help.
And might I add, heck of a nice guy, too. Heck of a nice guy. Good to have you. We'll have you come back again soon, okay?
Thank you for having me.
Good to see you again.
Great to see you as well.
All right.
Thank you.
Thank you, Dr. Trattler. And that'll do it for our show today. I hope you enjoyed it. If you have any questions or any ideas as to what we should cover, all you have to do is follow us on Twitter at WSFL. And of course, you can always get us on Facebook at SFLCW and Inside South Florida. We will see you next weekend. And of course, you can always catch us every weekday morning for our morning show, Eye Opener, from 6 to 8 a.m. right here on SFL TV.